Hi, I'm Natalie, nurse practitioner with Clinic 5410, and this video we're going to talk about drawing up your medication and using the proper dose. The first thing you're going to do is wash your hands. I'm going to hand sanitize real quick. The supplies you'll need, you're going to take out your vial, one syringe, and an alcohol swab. With your vial, you're going to take off this plastic top, and it's not going to go back on. You can throw that plastic top away. Then you're going to take an alcohol swab to clean the top of your vial. You'll do this every time you inject or draw up your medication. For the video's sake, we're going to be on 10 units of semaglutide. This might not be your dose, so make sure you refer back to your box to check your proper dose. After cleaning off the top of the vial, I injected 10 units of air into my syringe, and then I pull back on my plunger to the 10 on the syringe. You'll see on this syringe, there's hash marks 10, 20, 30, 40, all the way to 100. So when we say 10 units, that's what we mean. Okay, so now I have my medication all drawn up and it's time to inject. Now it's time to inject your medication. This is a sub-Q injection, which means it's gonna go into any fatty tissue. And this is a once a week injection. So if you inject on a Sunday, you're gonna inject 7 days later on the next Sunday, once a week. When you go to inject, you're first going to pinch the skin that you want to inject. Common injection areas are your abdominal tissue, your inner thigh, the back of your arm. Wherever there is fatty tissue, you can inject there. The first thing you're going to do is pinch the skin or the fatty tissue that you'll inject. Take your alcohol swab, clean off the skin. Then you'll take your injection and insert it into the fatty tissue and push your plunger all the way in. Common questions we get asked is how far I go in with the needle. You can go all the way in. This needle is very tiny. So go all the way in with your needle and push all the medication into the abdominal tissue. To show you the angle of injection, we'll pretend that this is your fatty tissue that you're about to inject. It's a 90-degree angle. So as you're pinching the skin, you're gonna go straight in all the way with the needle, inject your medication and come right out. You'll never reuse your needle, so once you are done, you can throw this away. We'll give you enough supplies to last you the entire 12 weeks.